name is Isma and I run an ABA therapy center. I'm a BCBA, a behavior analyst, and my center is called i.kare, and we are based in Karachi, Pakistan. i.kare was started in 2019, and prior to that, I was working privately from my home. In this institute, the primary aim is to work with children with autism and other developmental delays. And what that ultimately means is many children who come to us lack communication, are unable to communicate their needs. And aside from that, we also work on their functional life skills. For example, toilet training, hand washing, instruction following. Many of the children who come here will either grab the hand when they want something or cry for what they want. So we focus on early intervention, whereby we have children between the ages of 2 years old till about 10 years old. And we first perhaps start with sign language and then develop it into vocalizations. So ultimately, the goal is communication and functional living skills.
As a parent, what's the experience of bringing up an autistic child? Could you talk about that?
Absolutely. So for parents, bringing up a child with autism is a very difficult thing, because parents with children with autism, first of all, many times are not fully aware of what autism means. So they often themselves feel confused about understanding their child. Okay, why is my child randomly babbling sounds? And why is my child looking from the corner of their eyes into the fan or the light? Or why is my child getting anxious because of loud noises? So many times, one of the biggest struggles for parents is that they don't understand their child. So as a result, for them, it's very important to educate themselves about what autism is. As a parent, the struggle is often, I don't understand what my child is trying to tell me. Why? Because there's often a lack of communication with these children. So then the primary goal is we come in and we teach the child to communicate so the parent can understand. So sometimes the parent feels frustrated or upset that they don't understand what the child is trying to say and they don't know how to help them out. But I do believe that every child presents various challenges in life, be it typical or non-typical. And it's very important to embrace the child and help the child reach their maximum potential to work with the child. The best therapist for a child is the parent. So it's important for them to be involved with their child to help them out. Autism is a developmental delay, and the primary symptoms are lack of social and communication issues. So for example, lack of conversation, communication, understanding other people's emotions, perhaps even lacking empathy, also creating friendships as well. So that is one of the issues. Another issue that they face is repetitive or stereotypical behaviors, which are essentially when a child repeatedly engages in a specific type of behavior, be it hand flapping, tiptoe walking, constantly playing with the same toy, in the same way, wanting routine, rigid behavior, which is ritualistic. They might like the same song and they might obsess over the same song over and over again. They get used to one person, they don't like change. Sensory behaviors, so some might be hypersensitive or hyposensitive to certain sounds, textures, tastes. I myself run a center, so I have about 9 therapists on my team, so I work with them. And I've trained them as well to conduct sessions, so they conduct the sessions. And aside from that, of course, I've worked with autistic children predominantly. So my experience has been in the field for almost 10 years now.
What are the day-to-day challenges to take care of someone with autism?
Some of the day-to-day challenges are, first of all, children with autism often lack communication, and that becomes a challenge because one is unable to understand them. So incorporating a communication system is very important. Another day-to-day challenge could be that they get frustrated when there's a change in their routine or schedule. So having a visual schedule to show the child that this is what they're going to do first, then this, then this, and this, helps them align with their thoughts and feelings and follow that schedule. Other day-to-day challenges could be that they may have sleeping issues or eating issues. So many children with autism have gut health issues, constipation, which can impact their mood. Some of them are very picky eaters, so they only eat one specific thing. So that can be an issue because, of course, if they go out, they'll struggle. Some of them struggle with certain noises, which give them a lot of anxiety and anxiousness. So that could be another day-to-day issue. And also many a times, children with autism, if they're not motivated to learn or focus, they may seem disinterested or want to run away. So it's important to use an incentive system with them.
Are the parents well equipped? Are they organized to look after a person with autism?
Well, within Pakistan, I feel like parents unfortunately do not have enough training to manage such children. So in terms of them being equipped, very few parents are actually equipped, and very few parents actually take the initiative to want to be equipped. They rely on therapists and their house help. Many of them even give up on the child because they don't know what to do, or maybe they don't have the time to do it. So as a result, we at i.kare try and get parents to observe this client sessions, and we have trainings so that parents are better equipped to manage their child, because ultimately they spend the most amount of time with the child, and it's important for them to manage them best.
Is there any awareness in Pakistan, around Pakistan, about this organization? And do you go out, give any facilitations, and give awareness to other places in Pakistan? And do they know what autism is in Pakistan, or is there not that much awareness out there in Pakistan? What is the views on that in Pakistan?
Well, I would say that generally in Pakistan there is awareness, but not very much. And I have conducted a TV show for 2 months. I've done a bunch of workshops and talks to raise awareness. I have a social media page and a following, which generally helps get the word out there, where we put up techniques, tools, as to how to work with children. Aside from that, I mean, yes, Touchwood i.kare is one of the leading and one of the most popular therapy centers in Karachi, Pakistan. So a lot of people know about it because there are very few licensed practitioners, and I was the first to move back to be living in Pakistan who started a center here. There have been other analysts, behavior analysts, but they would come intermittently. So, I mean, there is awareness, and people do know i.kare. As far as autism is concerned, there is a lack of awareness, but it's better than it was 5 years ago. But there's room for a lot more awareness needed.
Do autistic children present a more difficult challenge to look after than our expectations hope for as parents?
I mean, they are more difficult to manage just because there's a communication gap that takes place. But I do believe, and it can be difficult because when they're frustrated and they don't know how to express themselves, they may have behavioral issues. But so that can be a challenge. But I do think it's very much something you can overcome if you teach your child the right way to communicate, for them to be able to express their thoughts. And that reduces the challenge. Also, they require constant work. So if you constantly work with them, they're more likely to learn. So they need repeated teaching.
So my mum, she works with autistic children as well, and she says they're the best people to work with. But like she says, when they're in a new environment, or when they go to new place, or when it's loud noise, they don't like that. So what outcome can be done to that to improve people when they're working with students in schools or colleges?
Well, I often recommend that sometimes there are noises which you cannot completely eliminate. So like in a school, there's a bell, and some children may not like the bell ringing. So what I recommend often is desensitizing the child. So starting with doses of ringing the bell, and maybe let's say for 2 seconds when it's not ringing. So you have to work on it in isolation, and you ring the bell, and then if the child responds okay, you kind of reward them for managing the sound, and then you continue to ring the bell again until they sort of essentially get desensitized. So I do think it's possible to work on desensitization. Autism is it's become fairly common, and they say for every 4 boys that have it, 1 girl has it. It's more prominent in boys, and they say 1 in 54 children have it, or 1 in 52, which is quite prominent. It's definitely almost going to be, eventually they say that it's going to be as prominent as depression is, which is quite a high ratio and rate. In terms of the ranking, I mean, they're all very different. Autism is different to ADHD, which is different to dyslexia. So I wouldn't really be able to put them in a ranking order, but of course, autism would be slightly more challenging to deal with. Why? Because it's the lack of communication. And that's more difficult to handle than a child who might be hyper, but who can communicate. So communication is the most important thing a human being needs. And if they're lacking that, that makes it harder. In the other delays or development delays, there are other issues, but communication is there. And that's why I believe that autism would be a bit more challenging than others. I mean, to get a diagnosis with autism, you have to go to a psychologist or a psychiatrist. So it depends on their availability ultimately. There are certain doctors who can diagnose a child within a single visitation, or they're doctors who will take a couple of sessions to observe a child. The waiting list in Pakistan for diagnosis is not particularly long. So it's very much possible. Having said that, there are not too many who are very accurate. So it's important to go to a good person. But generally, the diagnosis ultimately can take between 1 session to 15 sessions, if not more.
What best tip, advice would you give to someone, their parent or the teacher or client that has a son or daughter or a student that is with autism?
Well, the ultimate best advice that I would give you is focus on the child's goals and skills, not your own, and take the lead of the child and try to go down to the child's level. Don't force your child to do things because it gives you happiness as a parent. Don't force your child to go to school if the child is not ready to go to school just because you want them to go to school. So always watch your child and follow them accordingly. You need to go to their world. They're not going to come into your world. So you need to go down to their level, go into their world, and kind of lead the way accordingly. Having a very generic approach with a child with autism versus a typical child will not always work. So it's important for you to work according to their level, and for you to be patient with them, and for you to try your best to understand them. To increase autism awareness, ultimately, yes, talking about it, sharing social media posts about it, having workshops and talks. And ultimately nowadays, I think social media is the best way. So it's essentially just spreading awareness through that.
And what's your advice for someone who's looking after autistic children if they're facing challenges and they're finding it difficult to look after the person with autism? What do you think they should do?
Well, I mean, if someone is finding it difficult to look after with someone with autism, it's important for them to go to a professional who can help guide them as to what to do, and also try and understand what the issue is. I mean, it's a very broad question. It's very hard to say specifically, but ultimately try and understand your child and see through their communication what they're trying to tell you. So मेरा नाम है Isma खान और मेरा सेंटर का नाम है i.kare, i.kare. हम कराची में हैं, पाकिस्तान में, और अगर आप मिलना चाहते हैं तो आप हमारे फेसबुक पेज, इंस्टाग्राम पेज पे कांटेक्ट कर सकते हैं. हमारा नंबर है, वहाँ ईमेल एड्रेस है, तो कहीं भी सोशल मीडिया पे आप कांटेक्ट कर लें और आपका अपॉइंटमेंट भी बुक हो जाएगा. The next step for the organization is ultimately to license some of my therapists to become internationally licensed therapists. And apart from that, I'm looking to collaborate with schools to bridge the gap between therapy and schools, and hoping to work on a parent support group that I've started to counsel parents as well. Well, I ultimately balance it by having a routine, and I have a fairly standard schedule where I wake up in the morning and I have my running, I run or I go to the gym, so after work out, then I come to office, and then after work, I'm usually with my family or doing chores and work. So I generally have a fairly structured day, which I follow, and I start my day early. So I start my day by like 6 a.m. So I end early as well. And that's kind of how I balance it. And it's most important to keep a positive mindset. That's what keeps you going. They can contact us on our social media page. It's under Isma Khan's name or i.kare. And we have a number, which is local Pakistani number, which is there, 0092 307 296 1878. And that's the main number, so they can contact us there on WhatsApp as well, and also on social media. Well, it's Mahan, ISMAKHAN -I.KARE. Of this is Mahan. We'll get all the links.